CNA Diabetic Neuropathy Foot Care. Welcome to the quiz. Question 1. You are helping a resident dress after a shower. They have left-sided weakness from a stroke. In what order should you put on their clothing and why? Option A. The order doesn't matter as long as they are dressed. Focus on their comfort and modesty. Option B. Start with the left, weaker, arm and leg, then the right. This allows you to manipulate the weaker side first while the resident can still assist with the stronger side, and it makes undressing easier later by reversing the order. Option C. Start with the right, stronger, arm and leg, then the left. This is easier for you and faster for the resident. Option D. Put both arms in the shirt at the same time to save time and minimize discomfort. The answer is B. Dressing the weaker side first is standard for hemiplegia care. Option A is incorrect because order does matter for ease and safety. Option B is correct because dressing the weaker side first allows you to maneuver the limb while the resident can still assist with the stronger side. Option C is incorrect because dressing the strong side first makes it harder to dress the weak side. Option D is incorrect because it's impractical and may cause discomfort. Remember, we can take your CNA exam for you, remotely and undetected, and with 85% score guaranteed, no fails, no upfront fees, no deposit, pay only after results. Message us via number in bio to schedule your session. Question 2. A resident has a urinary tract infection, UTI, and is suddenly confused, restless, and trying to get out of bed. This is a change from their usual alert status. What is your priority action? Option A. Sit with them, try to reorient them calmly using a soothing voice, and call the nurse immediately to report the acute change in mental status, as this could be delirium caused by the infection. Option B. Apply a soft wrist restraint to prevent them from falling, as safety is the top priority. Option C. Give them a PRN sedative from the medication cart to calm them down so they will rest. Option D. Tell them firmly to stay in bed and pull the side rails up to keep them contained. The answer is A. Sudden confusion, delirium, in a resident with UTI is a medical emergency. Option A is correct because sudden confusion, delirium, in an elderly resident with a UTI is a medical emergency that requires nurse assessment. Option B is incorrect because restraints require a doctor's order and are not first line. They can increase agitation. Option C is incorrect because CNAs cannot administer medications, and sedating without addressing the cause is inappropriate. Option D is incorrect because firm commands may escalate, and side rails alone do not prevent falls if they climb over. Question 3. What is the primary purpose of turning and repositioning a bedridden resident every 2 hours? Option A. To make the resident more comfortable and prevent boredom from lying in one position. Option B. To give the nursing assistant a chance to check the resident's skin for any breakdown. Option C. To prevent contractures and maintain joint mobility. Option D. To relieve prolonged pressure on bony prominences, which compresses capillaries and restricts blood flow, leading to pressure injuries, bed sores. The answer is D. Pressure relief is the primary goal of turning schedules. Option A is a benefit, but not the primary physiological reason. Option B is a benefit, but not the primary purpose. Option C is a benefit, but not the primary purpose. Option D is correct because the main goal is pressure relief to prevent pressure injuries. Question 4. When assisting a resident with a sitz bath, what is the most important observation for you to make and report? Option A. How long the resident sat in the bath to ensure they don't exceed the ordered time. Option B. The water temperature to ensure it is warm, not hot, and comfortable for the resident. Option C. Whether the resident found the bath comfortable and soothing for their perineal discomfort. Option D. The color and amount of any drainage, bleeding, or clots in the water after the bath, as this could indicate a complication from hemorrhoids or postpartum/episiotomy healing. The answer is D. Abnormal findings like bleeding require immediate reporting. Option A is important, but secondary. Option B is important for safety, but the observation of the outcome is more critical. Option C is subjective and not the most critical clinical observation. Option D is correct because abnormal findings like bleeding or discharge need immediate reporting to the nurse for assessment. Question 5. A resident on fall precautions is attempting to get out of bed by themselves. What is the best way to approach this situation to maintain safety and dignity? Option A. Pull the curtain and ignore them so they don't become more agitated, hoping they will get back into bed on their own. Option B. Approach calmly but quickly, offer your arm for support, and say, "I'm here to help you. Let's make sure you're safe. Where were you thinking of going? Let me help you." This addresses the need while ensuring safety. Option C. Run to the resident and firmly push them back into bed, explaining that they are on fall precautions and cannot get up alone. Option D. Yell from the doorway, "Stop. Stay in bed. I'll be right there," to halt their movement. The answer is B. A calm, supportive approach respects dignity while ensuring safety. Option A is incorrect because ignoring them is unsafe. They could fall. Option B is correct because it calmly addresses the situation, offers assistance, and respects the resident's need to move while ensuring safety. Option C is incorrect because pushing them back can cause injury and distress. Option D is incorrect because yelling may startle and agitate them. Question 6. You are collecting a routine urine specimen. What is the correct procedure to ensure an uncontaminated sample? Option A. Have the resident void into a clean, dry collection container, like a hat placed in the toilet, then pour the urine from the container into the specimen cup, filling it to the required line. Do not let the cup touch the container. Option B. Take a sample from the urine already present in the bedside commode to avoid bothering the resident to provide another sample. Option C. Ask the resident to urinate directly into a sterile specimen cup, holding it in place. Option D. Send the entire bedpan with urine to the lab so they can collect the sample themselves. The answer is A. Using a clean collection container and pouring into the specimen cup minimizes contamination. Option A is correct because using a clean collection container, hat, and then pouring into the specimen cup minimizes contamination. Option B is incorrect because urine from a commode may be contaminated with water or cleaner residue. Option C is incorrect because it's difficult for the resident to aim directly into a small cup, and it may contaminate the outside. Option D is incorrect because sending a whole bedpan is impractical and unhygienic. Great job! Don't forget to subscribe. Bye!